Hi, everyone, and welcome to this week's episode of Marley the Midwife. In today's episode, we're discussing the relationship between self and community in relation to midwifery. Throughout this discussion, I'm going to explore the interrelatedness of self and community, as well as some Catholic social teaching principles and how they connect to midwifery care. So, what is self? What does self contribute in midwifery care? Well, self is what the individual can contribute to the community, as well as their experiences, values, culture, beliefs. In the case of midwifery care, there are many individuals to consider: the midwife, the pregnant person, other care providers, her support network. And then we look at community. Community refers to the group you belong to. In midwifery care, this may refer to the community area, the hospital community, the midwife, and many, many more. Here we can consider the South African concept of Ubuntu, concept of giving, sharing, and caring for your community. When translated into English, Ubuntu roughly translates to a person is a person through other persons. When we look at midwifery care, we can see that we all contribute as individuals to create community. So when we're talking about how self and community interrelate, what does that mean? Well, the Cambridge Dictionary defines interrelatedness as connected in such a way that each thing has an effect on or depends on the other. In the case of midwifery care, the woman depends on the midwife for medical education, guidance, support, and access to medical intervention if required or desired. The midwife depends on the woman for guidance on what she would like her treatment to look like, her values, beliefs, and culture. The way the midwife approaches the care has an impact on how the woman experiences her pregnancy and labour. Midwifery care is about the self, being the pregnant person, and involves the community, being the midwife and other supports within the community. The other concept we're going to be analysing today are principles of Catholic social teaching. Catholic social teaching is a body of work that can be applied to any person wanting to prioritise goodwill. It aims to guide people on approaching the world with human dignity, integral human and ecological development as a priority. There are 9 principles of Catholic teaching, but for the purpose of this episode, we're just going to focus on 2: subsidiarity and human dignity. Human dignity refers to the belief that human life is sacred. Human dignity is the heart of ethics and aims to protect the dignity of all humans. Subsidiarity is the belief that all people have the right to be involved in the decisions which affect them. Both of these principles highlight how midwifery incorporates the Catholic social teaching principles, which we'll discuss later in this episode. Going back to the concept of Ubuntu, I want to have a look at how Ubuntu and midwifery interrelate with one another. For the majority of midwives and nurses, care is at the heart of the work that they do and the philosophy they follow. As a midwife, it is our role to care for birthing people, their family, and their baby within a community setting. We work in collaboration with the birthing person, discussing their preferences, their beliefs, how we can achieve these goals together, what their family looks like, their culture, their religion, and how we can contribute our knowledge alongside theirs. Midwifery care has existed within communities for as long as human history is written. In the history of midwifery care, birth attendants often didn't have formal training and rather would attend births within the community from a young age and receive knowledge from other birth attendants with decades of experience. Birth would more commonly occur in the community, either with a home birth setting or a community birthing house. It was common for people to be present during the labour: neighbours, family members, children, friends. It was a community event in which everyone would gather to support the birthing person and their family, contributing meals, childcare, cleaning, and social support. To me, this is the most pure example of Ubuntu: giving, supporting, caring, and more importantly, being one with the community. As a midwife, I continue to hold these traditional values at the heart, but acknowledging my part in the birthing person's journey whilst also acknowledging that it is her journey. Another aspect of Ubuntu within modern midwifery is the benefit of the continuity of care model of midwifery care. Continuity of care involves a pregnant person seeing one key midwife for the majority of their care throughout their pregnancy, labour, and delivery, and occasionally their postnatal care as well. This model of care has been found to leave women feeling more empowered, informed, and trusting of their care provider. The midwife and the pregnant person are able to collaborate fully and achieve their goals as a team. This is the epitome of community care and Ubuntu within midwifery. Now let's consider how our principles of Catholic teaching interrelate with midwifery. First, we have human dignity. Studies have shown that patients place high value on being treated with dignity and that it improved their experiences within the healthcare setting. They felt safer, had improved stress levels, and prevented medical trauma. During pregnancy, labour, and birth, a person is in a very vulnerable position as they experience pain, change, and private exposure. To be able to provide care for these individuals, it is vital to honour their human dignity to provide a safe environment for them and their families. Some argue that during pregnancy and labour, women lose their dignity as they're required to relinquish their privacy. As a woman is exposed to medical interventions, it is possible she may lose autonomy over her body and her labour, again losing more dignity. This is why it's my firm belief that it is the role of the midwife to protect our women's human dignity. This may look like educating our women on their options, protecting them from intrusive care providers, building a relationship to allow the woman to feel safe, and understanding the woman. This brings me to the next principle of Catholic social teaching, subsidiarity. Informed consent is vital in all aspects of healthcare, not excluding midwifery care. Informed consent embodies the principle of subsidiarity by ensuring the birthing person is the key decision maker regarding all aspects of her care and her baby's care. She is informed, educated, and empowered to make decisions based on her values, culture, religion, and her family. Subsidiarity is the belief that individuals are the expert in their own needs and desires and therefore should be in control of their decisions. Informed consent in maternity care has huge benefits, including the woman feeling safe, less pain with intrusive examinations, the woman feeling strong and in control, the woman feeling that the midwife understands her needs. Overall, self and community both play a huge role in providing midwifery care, as highlighted through Ubuntu, human dignity, and subsidiarity. Thank you for joining me for this discussion today. Bye.